How is Camptocormia diagnosed? Camptocormia is a condition that causes a significant forward bending of the spine, especially when standing or walking. This bending often improves when lying down. It is frequently seen in people with Parkinson's disease and can be quite disabling. Diagnosing camptocormia requires a thorough clinical and diagnostic approach. First, a healthcare professional will conduct a detailed neurological and physical examination. They will focus on your posture and spinal alignment. The key sign of camptocormia is a marked forward flexion of the thoracolumbar spine that worsens when you stand or walk but improves when you lie down. During this evaluation, the doctor will also assess muscle tone, strength, and look for any signs of dystonia or rigidity, which are common in Parkinson's disease. The Unified Parkinson's Disease Rating Scale may be used to assess the severity of muscle involvement. Next, imaging studies play a crucial role in the diagnosis. Radiological imaging, such as spinal X-rays or magnetic resonance imaging, can help rule out any structural spinal abnormalities, fractures, or deformities. Magnetic resonance imaging may also be used to check the paraspinal muscles for signs of muscle atrophy or fatty infiltration, which can occur in chronic cases of camptocormia. Additionally, muscle ultrasound can evaluate changes in muscle echogenicity that may indicate underlying myopathic processes. Electrophysiological tests, such as electromyography, are often performed to detect any myopathic changes or muscle inflammation in the paraspinal muscles. In cases of camptocormia related to Parkinson's disease, electromyography findings typically show abnormalities that suggest muscle involvement due to central nervous system dysfunction. In some cases, a muscle biopsy may be necessary. This involves taking a small sample of the paraspinal muscles to identify any myopathic or inflammatory changes. The pathology from the biopsy can reveal issues like fiber atrophy or mitochondrial dysfunction, which supports a diagnosis of secondary myopathy linked to Parkinson's disease. It is also essential to consider other potential causes of camptocormia. Conditions such as primary myopathies, dystonias, or peripheral nervous system disorders must be ruled out. The diagnosis is further supported if the individual has Parkinson's disease along with the characteristic clinical features of camptocormia. Finally, understanding that camptocormia in Parkinson's disease likely results from abnormal muscle tone regulation and proprioceptive dysfunction is important. This central origin differentiates it from purely muscular causes and shapes the diagnostic approach. In summary, diagnosing camptocormia involves recognizing the characteristic postural deformity, confirming the absence of structural spinal issues through imaging, identifying muscle involvement with electromyography and possibly biopsy, and considering the central nervous system mechanisms at play. This comprehensive approach helps distinguish camptocormia related to Parkinson's disease from other neuromuscular disorders and guides appropriate management. Always consult a healthcare professional for personalized advice and treatment options.